is intensifying efforts to combat terrorism by sharing experiences on how to counter its evolving nature. Speaking at the 4th Nairobi caucus on enhancing border security, Principal Secretary for Internal Security and National Administration Raymond Omolo cautioned that porous borders are being exploited by terrorist groups for recruiting, trafficking and other illicit activities. He noted that in 2024, more than 80% of extremist-related fatalities in Africa occurred in border regions, underscoring the urgent need for coordinated action.
Primarily, we're just looking at how to progress the fight on terrorism. So they're looking on the terrorism measures, experiences how to navigate the mutative based on nature. So without really having to say much, is that terrorism remains one of the biggest threats, not just in the country, but all of the issues of how to share intelligence, how to share resources, how to build capacities, and also modalities, because that is where most terrorist activities are.
On her part, the European Union ambassador to Kenya, Henrik Geiger, stressed that Europe's security is closely tied to Africa's stability, emphasizing the importance of joint efforts.
And the EU has realized that there cannot be any security in Europe without security in Africa and in other regions. That's why we are facilitating those cooperative spaces, including connecting the African agencies with Interpol.
The caucus, attended by representatives from over 15 African countries and international partners, aims to develop actionable strategies to disrupt terrorist networks and strengthen regional security. Health unions, led by the Kenya Medical Practitioners, Pharmacists and Dentists Union, have accused insurance companies of sabotaging healthcare services, with Nairobi hospitals cited as a key example. Addressing journalists, the unions, including the Kenya National Union of Nurses and Midwives, the General Union of Kenya Civil Servants, the Kenya Union of Clinical Officers, and the Kenya Union of Nutritionists and Dietitians, condemned what they described as unfair allegations by insurers against the hospital's management. They claimed insurance companies were colluding to dictate which hospital, doctors, tests and drugs patients could access, thereby interfering with care. The unions further accused insurers and third parties of coming between doctors and patients, warning that the practice was undermining the quality of healthcare delivery.
Insurance companies that are covering doctors, they're covering workers, and they're covering Kenyans. And this is not limited. These insurance companies work and insure patients in all private hospitals and in public hospitals. But we are saying that as much as we speak every day about the universal health care, the biggest impediment to universal health care in this country are private insurance companies.
Away from health, Interior Cabinet Secretary Kipchumba Murkomen has identified alcohol and drug abuse as the biggest security challenge in Murang'a County, blaming rogue distributors for driving the problem. Speaking during a Jukwaa la Usalama forum in the county, Murkomen announced that the government will scale up a multi-agency crackdown to dismantle networks behind the illicit trade. He also cautioned political leaders against inciting farm invasions under the pretense of addressing historical land injustice.
The challenge we face in Murang'a is alcohol and drug abuse. Again, let me say that biggest problem here is the misuse of the alcohol distribution licenses for actually combining both legitimate or legal alcohol and the illegal one.
And Farm Systems Kenya has launched a grassroots sensitization campaign to curb illegal donkey slaughter, warning that the practice is pushing the species toward extinction. The initiative, rolled out in Kiambu, Narok and Bomet counties, areas with the highest cases of illegal killings, will feature bikers championing donkey protection. Speaking at the flag off in the year, FSK Executive Director Kenneth Wamuga said the campaign will also raise awareness among law enforcement officers, urging them to step up inspections at roadblocks for vehicles suspected to be transporting donkey meat and hides. During the event, calls were made to lawmakers to speed up policy amendments banning the international importation of donkey hides.
Na siku hii ya leo tuko na furaha kuweza kuungana na serikali yetu ili tukaweza kuhamasisha law enforcement officers wetu kuhusu maneno ambayo inaitwa the donkey hide trade. Hivi karibuni mmeweza kuona ya kwamba kumekuwa na uchinjaji wa punda kwenye vichaka, na pia hii nyama inafika katika kitoweo chetu.
And in Marsabit, more than 450 households will now access clean and reliable water following the installation of a new borehole under the Karatina Water Project in Saku sub-county. The facility features masonry tanks, extended pipelines, kiosks, watering troughs, and prepaid meters to ensure a sustainable supply for both families and livestock affected by drought. Commissioning the project, Marsabit Deputy Governor Solomon Riwe urged residents to safeguard the new water source. In collaboration with the county government, Airtel Kenya, and the Red Cross, 4 additional water points have been rehabilitated in Samburu County, benefiting 1,950 households and easing long-standing water shortage in the region. And in Lamu County, nurses have gone on strike after failing to reach an agreement with the county government over their grievances. Speaking at Mpeketoni Hospital, the nurses said they had submitted their proposals earlier this year, but the county had not taken sufficient steps to address them. Union leader Eric Otieno announced that the strike would continue until their concerns are heard, accusing the county government of neglecting health workers' welfare. He also condemned threats to dismiss nurses participating in the industrial action, insisting that such intimidations will not stop them from demanding their rights.
Rais alipohutubia nchi siku ya labor hii tu mwezi dizia, alisema vizuri kwamba zile county ambazo hawaja implement hii salary increment wanafanya kinyume na sheria, na hivyo basi tunaambia mwajiri wetu kwamba mambo haya tunataka iangaliwe kwa undani sana, itimizwe kikamilifu ili tuweze kurudi kazini. Kuanzia sasa hivi wauguzi wametoa huduma yao mahali pa kazi mpaka siku yenye mambo yetu itakayotimizwa.
And that's it from the Eastleigh Voice News Desk.